Okay, so this one's a really quite an interesting one. So the patient's presented, he's stood on a piece of glass fishing and he's had his foot stitched up probably about 12 months ago. And the pain's come back after about 10 months of him having the stitches out. So he thinks there might be a piece of glass in here. Now if we go, basically we take a look in here and just trim off some of the hard skin. You see there's a corn right in the edge of the scar. So that's what's causing the pain. So that scar tissue is really quite soft. So anything that pushes on it will be painful. So this is actually the second time we've done this one. So we knew what it was going to be. So the corn is getting pressure, or the skin's getting pressure put on it right on the edge of the scar, on the edge of the shoe, on the edge of the metatarsal head. So they all sort of converge to cause this unfortunate situation where you get this really nasty little corn on a particular tender spot because the scar's a lot more sensitive now than the surrounding skin would have been. So this is instant relief. So we just go in there and remove this one, and basically he can walk out of here with no pain. But unfortunately, because the scar is causing extra pressure, it grows back every few months. So we'll do this one probably once or twice a year, and then he'll be pain-free. But unfortunately, other than that, we can help with the pressure by putting an insole in the shoe, making sure the shoe's wide enough and making sure the shoe's deep enough. But the scar reduction is actually quite difficult. So what we're going to do is just treat this one a few times and see how it actually responds. And this is, like I said, the second time we've treated this, and this is much smaller than what it was the first time. So basically what we'll do is go ahead and debride all the callus, remove the corn, and see how it goes in about 8 to 12 weeks. And hopefully we can extend those treatment sessions out.